The opportunity. Thanks for watching this video. I'm Mike McPherson, and this is going to be a short tutorial of how to read, understand these workouts, and how to enter the information so you can track your progress. First, you'll notice at the top, day 1, lower, day 2, upper, day 3, full body. So these are going to be the focus. Day 1 is going to be primarily a lower body focused exercise day. Day 2 is going to be primarily upper body, and day 3 is going to be full body. You'll notice there's 4 columns for each, and it says date at the top. So these are supposed to last you for 4 weeks. Ideally, you'll perform day 1, rest 24 hours, perform day 2, rest 24 hours, and then perform day 3. So you'd fill in this column, this first column of day 1, on like a Monday, rest 24 hours, fill in the first column of day 2, rest 24 hours, fill in the first column of day 3. That would be your first week, done. Then when you come back to day 1 again, now you fill in this column. You'll notice there's a blank spot underneath the date. That's for you to enter the date right there. Then you notice it says weight underneath, and that is for everything beneath there is where you're going to enter your weight. If there's no weight, you can enter a check mark, an X, body weight, something to let you know that you've completed that set in the repetitions. Each exercise, each day starts with core. Feels most important. We want to put that pelvis in a good position. And the way we do that, right, activate our core muscles, get our glutes firing, our abs, our obliques, our low back, things along those lines. So you notice this, there's 2 boxes for each one. So that means you have 2 sets of 30 seconds for the plank, 2 sets of 15 seconds for the Copenhagen side plank. So you do left, right, 2 of each. And then bench straight leg back bridge, you'd have 2 sets of 30 seconds. Once you complete all of those sets, then you'll move on to number 1. Ideally, you go through this in order, 1 through 7. You don't have to, but ideally it's kind of set up that way. We put first things first, where the most imbalances lie, where I feel that we are weakest due to our posture, just our assessment. That's what exercise we put first. The majority of us have weak hamstrings compared to a lot of other things in our body, so we're going to stress the hamstrings first. The way you perform this first set, it is with a superset, and what that means is you will perform back-to-back exercises within group 1 before resting. What does that look like? You'll perform a prone 1 dumbbell leg curl. You'll do 10 sets. And so then you'd enter, maybe you did it with a 15-pound dumbbell. You'd enter 15. As soon as you're done with your leg curl, you go right to standing hip flexion. Do a set. Then you would rest, right? 30 seconds to a minute, whatever your rest period is. Then we start again. We get our second set of prone 1 dumbbell leg curl, followed by hip flexion. Right, 15, I give a little X for hip flexion. Now you notice there's only 2 sets here. So your final set of number 1, you'll just do 10 leg curls. Call it good. You're all set. Again, what a superset allows you to do, it's going to allow you to perform more work in less time. So it allows you not only to perform more strength training exercises in the allotted time you have in the gym, or reducing the amount of time you're spending in the gym, but it's also going to increase the cardiovascular effect. You're going to get a little more cardio in performing supersets. 3-second eccentric, KOT is knee over toe, dumbbell split squat. Okay, we'd get a set of 5 on our left leg, we'd get a set of 5 on our right leg, and then we'd come here to our wall tibialis raise, set of 10. Then take our rest. Come back, 5 on our left leg, 5 on our right leg, come back to our wall tibialis raise, and then you'll rest, and then finish with your last set, a split squat. Now, something to always think about. Make sure, or do your very best, start with your leg that's been injured, had surgery on, or the leg that you feel is weaker of the 2. Right? Maybe you got a history of sprained ankles with one leg. Maybe you had ACL reconstructive surgery or meniscus repair, some kind of a high school injury, and you still feel that leg lax. start with that leg. Something else very important, make sure we're keeping the toes involved. Try and put as much weight towards the front of your foot, towards your arch and the ball of your foot as you can. We want to try and get that weight off the heels.